Hello and happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature is the management of diabetic foot ulcers through optimal offloading. I am honored to introduce the talent for this win segment, my friend and colleague, the inventor and driving force behind the first commercially viable standardized total contact casting systems, Dr. Jeffrey Jensen. Dr. Jensen is currently the Director of Research at Barry University School of Podiatric Medicine. And prior to this, Dr. Jensen was the owner and clinical director of the Diabetic Foot and Wound Center in Denver, Colorado. Dr. Jensen has been the principal investigator of over 30 multi-center clinical trials for wound-related drugs and medical devices. And he has received 6 patents addressing diabetic foot wounds and fractures. He is the mastermind behind Medicast and TCC Easy. And these devices have been used on tens of thousands of patients around the world to assist in their healing. Hello, Dr. Jensen, and thanks for joining us on this WIN segment.
Thank you, Jeff. At this time, I'd like to share with you an article that was written on optimal diabetic foot ulcer offloading. It was published in the JAMA Journal in the November-December issue of 2014. You can see from this article there's an esteemed panel. This group met together in Philadelphia in 2013 and spent 2 days going over all the articles that had ever been written on offloading the diabetic foot ulcer. We utilized the GRADE approach for this consensus document. It really enabled us to develop the highest quality evidence-based consensus statements that we could. We had 90 different articles that we read. They were all dropped into a Dropbox and all the panel members had access to them before the meeting. We developed 8 evidence-based consensus statements. And because of time constraints, I just wanted to share with you one that is very pertinent at this time. Number 4, total contact casting is the preferred method for offloading diabetic plantar foot ulcers, as it has most consistently demonstrated the best healing outcomes and is a cost-effective treatment. If you look at all the available options for offloading, and we use them all in our clinics, some are thought to work better than we might see in the evidence. As you can see, all the different modalities above in this slide, many of them have low evidence to support their use. What's really important is that on the bottom of the page, you can see different modalities that are used oftentimes, shoes, wheelchairs, post-op shoes, that have absolutely no evidence to support their use. The key recommendations that came from this document are the following. Likelihood of healing is increased with effective offloading adherence. The panel recommends total contact casting is the preferred method for effective pressure relief. And the evidence also consistently shows that if we offload the patient at each visit, the likelihood of diabetic foot ulcer healing increases and the chance of complications significantly decrease. It has been my privilege to participate in this WIN segment. Thank you so much for joining us.
Well, that's this week's WIN. Thank you, Dr. Jensen, for your clinical insight. We hope this clinical correlation will enhance your wound care practice. And be sure to send us your questions or follow us on Facebook, Twitter, or LinkedIn. Please enjoy a safe and relaxing weekend.